All right, hello, and thank you for joining us for this webinar on the final skilled nursing facility probe sample reviews for 2025. My name is Mary Sue Gardner. I'm a registered nurse in the Provider Outreach and Education Department, and I'm joined by Jennifer as well as members of Medical Review who are going to be helping with the question and answer portion of today's call. A few housekeeping items before we get started. As I mentioned briefly before, on our website, WPSGHA.com, we have a training center link at the top of the page. In our training center, you're going to find all things education, such as the training material, like the slide deck that we're using for today's event. There's also information about upcoming educational events and access to encore presentations that you can watch outside of YouTube. So this event is being recorded and will be posted within the next several days as an encore event. And those encores stay on our encore page for about 60 to 90 days. But they're always available on our YouTube page until the information is either changed or updated. Now, if you have any questions during today's event, you can place those questions into the chat and send that over to everyone, and we will get those questions answered for you. Finally, if you have any feedback about your experience today, there's going to be opportunity during this event to take the survey. Jennifer's going to place a copy of the survey link in the chat right now and also at the end of this presentation. And that way, if you find you have to leave the event early for whatever reason, then you have the survey link available for you right there. If you're listening as an encore, we also encourage you to take our survey. And the encore survey link should be at the top left of the screen. There's going to be a little eye with a circle around it, and it's also available at the end of the presentation, but you can always use the link in the description as well. On your screen is our disclaimer slide, and our disclaimer, which we have to give at every presentation, basically says we prepared this information as a tool to assist you, our Medicare provider community, with the Medicare laws, rules, and regulations. However, knowing Medicare laws, rules, and regulations often change, the information we're providing today is as accurate as it is on CMS's website today. So it's your responsibility as a provider to make sure you're following the most current laws, rules, and regulations that are in place on the date you provide those services. And remember, Medicare, CMS always has final coverage determination. On your slide now and on this next slide is a list of acronyms that I may or may not refer to as I go through this presentation. If I happen to mention an acronym that you're not familiar with, go ahead and just refer back to this slide. And if it's still not answered in this slide, because Medicare is like acronym soup and it's full of acronyms and we just say them all the time just out of habit. But if I say something and you don't know what it is, just put it in the chat and one of my associates will answer it for you. All right, why are we here today? My objective for today is that you learn about the overall findings from these 5 claim TPE reviews and how to avoid these findings on any kind of future reviews. We're going to go through a summary of the key findings. We're going to talk about strategies to prevent the most common issues. We're going to review some guidance on what steps are going to be taken next for providers who failed. And there's going to be some actual actionable takeaways to help you ensure compliance. The reviews at this point are coming to completion, and they should be completed if they're not already. There may be a few outstanding that are still in review, but otherwise all providers that can be reviewed have been reviewed. So at this point, providers that have incomplete samples, you are just going to close with whatever amount that you have sampled. So if only 2 claims have been sampled and 1 out of 2 was denied, then unfortunately your error rate is 50%. CMS has a hard deadline for claim reviews to be completed. And if a provider did not have a total sampled review, maybe because they did not bill enough claims that met the criteria during the review period, then they will just close with whatever they have. At this point, the CMS hard deadline is the end of this month. So there's really not enough time for us to request a claim, to allow that 45 days for you to submit, and to allow 30 days for us to complete the payment review before the end of this month. It just isn't going to happen. So again, the samples that are not complete will be closed out with an error rate of whatever amount they have sampled. So if a provider failed review, they will be subject to a regular TPE process. Now, CMS has set a standard that providers that failed 5 of 5 claim reviews would be included in the max existing Medicare or medical review strategy and TPE process. So CMS has already said that. If you fail 5 of 5, then your MAC should take you to the targeted probe and educate review process. And in that process, we would then review 20 to 40 claims. But know that, those providers that also had questionable error rates, maybe 4 out of 5, could also be subject to future targeted probe and educate reviews as well. It's just not a absolute, 100% that you will go. I also want providers to know that if for some reason a claim arrives after the 45-day remittance advice request date, that claim, remember, it actually denies in our system as no documentation received at the 45th day. But we can reopen the claim and make a medical review decision on it. So if you have anything that's sitting out there that you have not submitted, this is your reminder to please do so at this time. All right. In an effort to get this presentation done on time, I had to get the data a little bit early on this, and that's why these are the final reviews from April to May 22nd. So with the exception of a few numbers that we'll discuss, the errors overall are going to remain the same. Really, this was only inched out by, a few days to the end of May. And then those that trickle in within June timeframe or finish up, those are going to have a very insignificant amount on these overall numbers. But that's why, things look a little different than they have in the past. So again, this data from April to May 22nd of 2025. So let's start with J5. For J5, we have 2,447 skilled nursing facilities in our J5 jurisdiction. As of May 22nd, 2,311 have been reviewed and finalized. That was 99% of our goal by May 22nd. During this period, we closed 162 providers. Throughout this process, from start until now, we have 119 J5 providers that were excluded from this process. And providers were excluded could be because they are currently under review by another review entity, like maybe the UPIC or the ZPIC or the CERT contractor, or maybe they were just on a TPE or were still on a TPE when we started this project. So those providers we didn't want to review again because we had just reviewed them or we were currently reviewing them. So if that was the case, then we didn't need to sample them. So that's the reason 119 were excluded. If in J8, we have 560 skilled nursing facility providers. 519 of those were completed by May 22nd. So again, that was 99 percentile of our J8 providers. During the last period up to May 22nd, we closed 22 providers. In J8, 35 providers were excluded from the program. So I do see that a question came into the chat, and I am going to answer that right now. And it says regarding the fail rate. If a claim was downcoded, was this considered to be a fail when calculating the rate? And the answer to that is yes. An error is an error. If it was not billed at the appropriate level because the documentation didn't support the level that was billed and the claim was downcoded, that is a denial. So that does not change, even though we still gave you Medicare money, just at a lesser rate, it's still considered a denial for overall denial purposes. All right, moving on. Moving on to closed provider errors by claim count. So continuing with the data portion, let's talk about the claims that were closed April to May 22nd. Starting in J5, again, we closed 162 providers. Of those 162, 14 in J5 closed with 0 errors. So they had not one error, all 5 claims passed. 26 closed with 1 error. But remember, when a 1 error out of 5 is 20%, so an 80% if you looked at that as a pass-fail. When we move on to 2 errors, we have 47 providers of the 162 that closed with 2 errors. So that accounted for 29.01 of all those claims we closed. That's a 60% on the passing scale. When we move to 3 out of 5 for J5, 26 claims, so 16.05 of the claims reviewed in this time frame, and that brings the pass rate down to 40. And then we'll move over and talk about J5. So during this time, providers that closed with 0 errors, so of those 22 that closed, 3 of those closed with 0 errors. Continuing on with 1 error, we had 2 providers, again, which is 9.09 of all the overall providers in J8 that we closed, the overall in that time period. So 2 of them closed, and that again brings us down to an 80%. 2 errors was 5, and 3 errors was 6. 3 errors was the most of the 22 in the J8. Again, 27.27 was the percentage on that. And again, just as a reminder, when we think about 3 out of 5 missed, that brings you down to a 40%. So not an area that you want to be in. All right. So again, remember the 1 through 4s won't necessarily go to a targeted probe and educate review. The 5s, CMS has said that that we as a MAC or all MACs need to take those to targeted probe and educate reviews. The 4s and 3s are also subject to targeted probe and educate, and that'll be based on data as we rerun it in the future. All right, so let's now move on and talk about the different kinds of errors that were found. On your screen right now is the top errors by jurisdiction. In the past webinars, this was the top 5 by jurisdiction. However, since there were so few overall claims in J8, they only had 3 top denial codes. So we're just going to discuss the top errors by jurisdiction. Either way, the errors listed here are by CMS reason code for the denial. So one thing I want you to note is in the resource page of your presentation, you have a link to find the CMS reason codes. I want to quickly just take you out and show you how to find these as well. So give me just a second and let me go here. Pull this over. And I'm going to show you how to find these. I'm going to go back to CMS's homepage. And so when you go to cms.gov, the easiest thing to do is just search for this. I'm a searcher, not a navigator. I tend to try to find and search the things that I want instead of going through all the various clicks of where it might be. So when I search just by the keyword reason code, this is what comes up. Either of these first 2 things are going to take you to where you need to go. I'm just going to click on the second one. So when you get here, this is the reason code statements and documents, the EMDR codes. And I'm going to scroll down to skilled nursing facility. And here's where you can find a list of all of these codes that we're going to discuss on the next several pages. Now, I bring you here and I want to show you this because when this ends, you're still subject to medical review. Anyone that bills Medicare is subject to medical review. So I want to show you, if you don't already know, where to find this information so you can link up what that actual reason code is to what the full description of that reason code is. All right, so again, you can see they're kind of grouped into different reasons. This grouping with the 400 have to do with therapy and evaluation, the 500 skilled services, the 600 MDS and billing, and back on the 300s are certifications, etc. Again, we're not going to dwell on this, but I just wanted to show you what that link later is going to take you to. So as we jump back out, just a few things I want to point out. The SN600, that's the first in J5. And the second in J8. And we're going to discuss these reasons in depth in a little bit. SN602, again, is the second in J8 or J5, but the third in J8. When we get into the SN300, it's the third in J5 and didn't even make an appearance this round in J8. SN700, however, is the 4th highest in J5 and the 1st highest in J8. And the GAN01 is the 5th highest in J5, again, not making an appearance in J8. And pretty much throughout this process over the last couple of years, these numbers, these codes, and maybe just a few other just changed slightly in ranking. But the SN600 has remained probably the biggest one overall. So we'll talk about that first. Again, first in J5, second in J8. These next 2 errors fall into the SN600 and SN602, which fall under the reason code heading of MDS billing errors, if you refer back to that reason code document on CMS's site that I just had up. On each of these slides, I have official wording for the CMS reason code, and then the AKA, or otherwise known as, information I'm basically going to refer to the AKA information and use the layman terminology when I'm talking about these. Just makes it easier. So the SN 600 is defined as documentation submitted did not support the level of service as shown on the claim. So the HIPS code was recoded to reflect the MDS changes supported by the documentation. So basically, in layman's terms, this means the documentation and the bill to Medicare did not match. And based on what we found in the documentation, we redid the MDS based on what documentation did support and allowed it to recode the claim, and then we paid at the corrected HIPS amount. Now for the important info. How do you avoid this error? You do that by ensuring that your documentation matches the HIPS code on the MDS. If it's not supported in the documentation, then it wasn't done. So we have to pay you at the rate that matches what is in your documentation. All right, moving on. The SN 602 is the next in overall ranking. Again, the second highest in J5 and third in J8. And this is defined as the HIPS code was recoded to reflect the HIPS code generated by the MDS found in the repository and supported by the documentation. So in other words, if you see this reason code, it means that the HIPS code that you billed to Medicare and what you locked in the MDS repository did not match. We actually recoded your claim to match what you locked in the repository because that's the one that was supported by your documentation. So for this one, it's pretty simple. Just make sure whatever you're locking into the repository for your MDS HIPS code, it's supported by your documentation and is also the same HIPS code that you bill to Medicare. Sometimes it's just a matter of fat fingering something. So you got it all locked in, everything was good. When someone went to report it on the bill, they fat fingered something. Unfortunately, if it was a finding that we made, it's still an error. So make sure that you are validating that your MDS was actually received, that it was locked into the repository, that it was locked into the repository without errors as well. If it does kick and say there's an error, make sure you're correcting those errors as well. All right, moving on, SN 300. And this falls into the certification recertification denial. This denial is for lack of certification and recertification. So the information is either just missing. This is a very easy denial to avoid. Just submit the required certification and recertification. There's no AKA on this because it's pretty self-explanatory. Your patient has to be under the care of a physician or a non-physician practitioner if allowable by your state. And your physician, non-physician practitioner has to certify the reason for continued care, the reason for care, the reason for continued care for the patient to be in your facility. So just as a reminder, certification is due upon admission or as soon thereafter as is reasonable and practicable. That's how the regulations read. The first recertification must be made no later than the 14th day of the inpatient extended service. So your first certification is due as soon as possible, but it has to be done by the time you do the 14th day. Can they be done on the same day? Yes, we will take it. Is that ideal? No, it's not ideal. But again, That's the first one, and then the first recertification is the 14th day. Subsequent recertifications are to follow at intervals no later than 30 days from the last signed recertification. Remember, all can be done before the date, but not after the date. And remember, to avoid this error, get your certification, recertification in your documentation and submit them with review. If we cannot verify your patient was certified for care by the physician or non-physician practitioner while at the facility, we can deny your services, and we will, because it's a condition of coverage. So the certification information can also be found in the IOM. So they are not only manuals, and that's publication 100-01, chapter 4, section 40. Section 40.5 also contains information about delayed certification should you need that information. All right, then the SN 700. That was the fourth highest in J5, first highest in J8. And this error basically is insufficient documentation. We just didn't get all the information that's needed for all of the components that need to be documented. So we'll go over some documentation components in a little bit here. Lack of documentation can and most often includes missing look-back information, or missing evaluations is the other big one. So for instance, we may have therapy notes for the date, but we don't have the therapy initial eval where we find all the start of care info. Generally, what leads to this denial, again, is look-back information. So remember, the way in which SNF gets paid is based on information that's gathered before the dates of service. That's why it's of utmost importance to get all the look-back information, especially when you start thinking of information that might have spanned back to the hospital stay. So we can see things like IVs, et cetera, that were administered in the hospital stay. So again, to avoid this, just make sure you submit everything that supports your dates of service billed, including look-back information and initial eval information from all the services that are on your claim. Make sure reports are complete. Make sure documentation is signed and dated. And ensure that you are always submitting the look-back info. It's just best, it's almost the best rule of thumb to submit the entire record if you can. That way you're going to make sure you're not missing anything. But again, dates of service as well as look-back information if you can't submit the entire record. All right, and finally the GAN01. That was the fifth highest in J5. To me, this one's kind of a silly denial, but it happened. I say it's silly because we've done so much education, made so many attempts at alerting our providers about the 5 claim reviews that everyone should have their billers on high alert. So if they saw a claim that moved into the status location of SB 600, and then the next day it moves into SB 6001, that should have alerted your providers, your billing providers, to jump on getting a hold of someone to submit documentation to Medicare. So your billers are the first ones to see this, long before even the letters come. Your biller should be contacting the facility and telling them they're going to need to submit documentation before that 45th day. So all facilities should have processes in place and should be watching their claims, that they complete and go to the payment floors. So for this one, if you're if you're on the Part A billing system and the documentation never got submitted for a review, you're going to see that this claim is eventually going to move into a 56900 denial, which means nothing was submitted in that 45-day time frame after an ADR was issued. You cannot appeal a no documentation received denial. Again, it is not appealable. There's nothing to appeal because there was not a medical review decision made on this. It's a technical denial based on nothing coming in. In order to possibly correct this, you need to submit for a clerical error reopening. And you can find information on our clerical error reopening and the form to use to submit it on our Part A portion of our website. And that's either J5A, J8A. If you go under forms and then claims correction, you'll find that form. There's several tips noted on this slide to avoid this issue. The first being, make sure you're responding appropriately in the time frame noted. If your biller happens to see a claim move into that ADR status location of 6,000, and then the very next day it moves to 6001, which generates the ADR letter, they should be, again, calling whoever to make sure that the documentation gets submitted. So you also want to make sure that your MRCA information in PACOS is also correct and up to date. So who's your medical review contact, that medical review contact information. If you are part of a chain or corporation where everything goes to a central location, again, make sure you have a plan in place to ensure that all of your facilities know when they are under review and what documentation needs to be gathered and submitted in a timely manner. Before we move on to the Q&A, I just want to briefly discuss some documentation guidance. All right, these next few slides just contain a list of documentation requirements for Part A SNF services. Remember, most of this documentation has a direct correlation to your MDS section. So for instance, the information from the hospital, such as the hospital summaries, transfer records, that is information that's going to be used for Section I and the active diagnoses during the look-back period. Section GG is all about your functional abilities and goals, and this includes self-care and mobility. So we're going to be looking at all your nursing notes and their assessments to support the items in GG. Section O identifies any special treatments, procedures, and programs. So we're going to be looking at medication administration records, especially your IV administration records, ventilator information, isolation, quarantine, etc. So accuracy in your documentation is critical because it plays a vital role in the PDPM reimbursement. And that's why I just wanted to highlight the requirements again, really quickly. So acute discharge summaries, transfer records, admission records, your physician orders and progress notes, nursing, anything nursing documents on, flow sheets, treatment records, their progress notes, social services and case management records, any kind of nutritional records, especially for patients that have swallowing issues, etc. We're going to want to see that dietary, nutrition, nursing are all following, the indications set forth. Your medication administration records and your IV medication administration records. Continuing on, any documentation of your activities of daily living or ADL records. When it comes to therapy, PT, OT, SLP, even if orthotics or prosthetics are in there as well. We need to see the evaluations, we need to see the progress notes, and we need to see the treatment records with the actual treatment minutes provided. And then physician certifications, recertifications, progress notes, again, orders, everything the physician documents on. Any additional plans of care that I didn't mention from any other modalities of treatment. Any diagnostic records that were provided, and a copy of the MDS. So that goes through briefly the documentation requirements. So on your slide are some additional resources. This is that one I told you where you can find the reason codes. And then this is just a little bit information about the 5-claim probe and educate and why it was done and what we did, etc. And a link to the MDS 3.0 for you. And let's recap. So a lot of information was covered. We learned about the common review findings that came up in this sample. And these common findings have been historically, just slightly changed in ranking throughout this process. But the ones I provided you today are the ones that have been happening all the way through. So we reviewed those and we discussed where we are in this review process, and we discussed those errors and how to avoid those, the otherwise known as, and the how to prevent. And we learned about tips to avoid these. Now, this doesn't mean that skilled nursing facility reviews are done. This just means that this 5-claim probe and educate of all skilled nursing providers across the whole nation, it's coming to an end. So again, if you are a provider that happens to have 5 out of 5, you will go on to a targeted probe and educate full review where we review, around 20 to 40 claims. And you will go through, you have at least 3 rounds in that process to pass. All right. Before we open up to additional questions and answers, I do want to give all skilled nursing facilities just a quick reminder. And please, please, please pass this along to your administrators. So in October of 2024, all MACs began sending off-cycle revalidation requests to all enrolled skilled nursing facilities due to some reporting changes that were made to the CMS 855A enrollment application. So this means it is applicable to everyone. Every skilled nursing facility had to revalidate. Due to the large amount of providers failing to comply, CMS has actually pushed this date from May 1st to August 1st of 2025. So you still have time. If you have not sent your SNF revalidation and you have questions, consider attending our webinar. We have one that's entitled SNF Revalidation Demystified, Your Top Questions Answered. And that webinar is actually on July 9th. That's getting real close to this August 1st date. So I do encourage you to look at some of our other recorded encore events on that as well. But if you want to wait and listen to the July 9th event, that, gives you a minimum amount of time before August 1st to get that in. But you can enroll for that event, even if you did already submit yours, and it's on our live events page. So remember that failure to comply with doing your revalidation will disrupt your Medicare payment. So know that that will happen. After that August 1st date, you will have a disruption in payment. All right. So at this time, I am going to look over at the chat and see if we have any questions that have come in. And I am not seeing any at this time. So in the interest of time, I'm going to move on. But if you happen to have a question, go ahead and place that in the chat and we'll stop again before I conclude the event. All right. After the webinar is complete, those of you who logged into this webinar, you are going to receive an email. You will not receive the email if you only called in via phone. So this email is also proof of attendance and has contact hours on it if you need that for continuing education. So make sure you don't delete that email without reading it. This email is also another opportunity to take our survey if you are not able to take it in one of the other means that we provide. Follow-up questions. If you think of any questions regarding this event, please email those to us at wps.gha.education@wpsic.com and send those within the next week. Please don't send any PHI or PII. And remember, we do not have access to the claims processing systems. So if you need information about that's specific to a claim, you will need to call customer service with those questions. And then I see a question came in that says, what is the expected time frame before TPE starts if you had 5 claims fail? And I am going to ask Colleen from Medical Review if she knows that answer yet. Colleen?
Hi, Mary Sue. I could tell you that we are getting our first providers on the TPE program starting in the month of August. So that's when we are going to start with those.
Okay, so, and those were some that started in the first round, is that correct?
This will be for the providers who have failed all 3 rounds and they had a 0, they had a 100% failure rate in all 3 rounds.
Okay, so yes, and you are welcome, Jesse. So that is already starting, well, we'll be starting next month. So perfect. Thank you so much for your assistance. Mm-hmm. Yes.
Okay.
Oh, I'm a month ahead. For some reason, I'm thinking that we're already in July. No, I don't want to end my summer like that. No. Anyway, okay. So again, if you have questions, send those to us. Put something in the subject line like SNF 5 claim review, and we'll get that back out to you. And then, as I said at the start of the presentation, we value your opinion and we want to hear from you on how we did on this event. And so the survey for this event only takes a few minutes to complete. And that's why we want to give you the opportunity to take it now, why we're still in session, and why Jennifer threw it in there right now. So you can click on it, or you can just wait until the webinar closes. The page is going to pop up. It's going to look like this box right here at the bottom of the page with the yellow triangle. It's going to direct you to our actual survey. It's just WebEx's way of saying, hey, you're going to automatically be taken to an external site. And you can validate that by the first few things will say CMS, MAC, blah, blah, blah. And it'll have the word Qualtrics in it. So those are your way of knowing it's not spam or anything like that. So again, we want to know what else you need in the future. We will be continuing with skilled nursing facility billing, skilled nursing facility clinical information, but what else do you need? Just let us know and we'll be happy to add that onto our schedule of events coming in the future. And then finally, We want to hear from you. We're committed to making changes and improving your education experience. So as a result of some of those suggestions that come through the survey, and based on those survey comments, I want to let you know about some things that we have done. We have added chapters to our YouTube. And what I mean by chapters is if you go into the description of any of our YouTube videos or encore presentations that are loaded into YouTube, you're going to be able to click on a chapter in that presentation you want to go to. So let's say today you only wanted to go back and listen to the documentation section. You could actually click on the chapter for documentation. It'll fast forward you to that place in the encore. We also have added training indicators in our descriptions of our event, so you know if it's something specific to billing or if it's something specific to clinical, which would be like documentation and coverage criteria, if it's something that is Part A only. So look for those on our website. And finally, an LCD Education Expo has been posted to our website, and I am going to just quickly show you. Let me go to the WPS website, and if I went out here, I am going to choose the Training Center tab. I am going to choose Live Events. I'm going to scroll to the bottom of our live events. And right here, there's a Medicare Education Expo that I want everyone to be aware of. This Education Expo is an all-day event on Medicare policies. And this day is set up so you can tailor your day and attend any or all classes that you want. We've made them 50 minutes, so you have time in between. If you decide to register for all of them, that you have time in between to hit the restroom, refresh your coffee, whatever the case may be. And we're going to end the day with an open Q&A event where we'll take all the pre-submitted questions as well as any questions that were left outstanding from any of the above events, and all presenters will be available to answer those for you. So I do encourage you to go out there, again, under our live events tab, take a look at that, and consider enrolling for any of them. So on behalf of myself and Jennifer, as well as Medical Review, we want to thank you for your participation in today's event. This concludes our webinar, and you can now disconnect.